Televisa presenta.
Today we're going to present measles. We have in this program three scientists about this disease. There are Gerardo Rafael Villegas, Joel Isaac Salas Ortiz, and Jorge Fren Montiel Betancourt.
And we have a special kid today. His name is Diego Andrés Barrientos Esparza. And we are Ramiro Rodriguez, and I am Samuel Alexander. So welcome to this program.
Yes, welcome to the program. First, we're going to have the three scientists presenting this disease. Hello, guys. Thank you for being here. Thank you for your moment, and you'll have the word.
First, we are going to talk about the measles and what is. The measles is an infectious disease caused by a virus. It spreads easily from a person to person. It causes a blotchy red rash. The rash often starts on the head and moves down the body. Other symptoms include fever, cough, runny nose, conjunctivitis, feeling itchy and run down, and tiny white spots inside the mouth. As we can see in our patient, uh, we see the bloody red rash, and also he was coughing before we start. Some of the general symptoms are the first sign of measles is usually a high fever, which begins about 10 to 12 days after exposure to the virus and lasts 4 to 7 days. A runny nose, a cough, red and watery eyes, and small white spots inside the cheeks can develop in the initial state. After several days, a rash erupts, usually on the face and upper neck. Over about 3 days, the rash spreads, eventually reaching the hands and feet. The rash lasts for 5 to 6 days and then fades. On average, the rash occurs 14 days after exposure to the virus, within a range of 7 to 18 days.
Oh, what interesting. Who is next?
And then we have the diagnosis and treatment. Like, how is the measles diagnosed? A doctor will suspect measles based on the common symptoms, including fever and rash, and especially if the patient has recently traveled internationally or was exposed to someone with a fever and a rash. And the laboratory blood and tissues test from a throat or nose swab can confirm the diagnosis. Going for the treatment, we have that there's no specific treatment for an established measles infection. However, some measures can be taken to protect vulnerable individuals who have been exposed to the virus. Post-exposure vaccination, non-immunized people, including infants, may be given the measles vaccination within 72 hours of exposure to the measles virus. And we have the immune serum globulin, with pregnant women, infants, and people with a weakened immune system who are exposed to the virus may receive an injection of proteins or antibodies called immune serum globulin.
Whoa, what interesting. Who's the next one?
Well, I am the patient. I have the symptoms that we have seen, and an immune response of my sickness is that the body defends itself out with cellular immunity with cytotoxic T and lymphocytes and natural killer cells. Patients like me with reduced immunity based on weakening of this part of the immune system are at high risk of severe measles infections.
Oh, what harm. What else we have?
So sad. Well, let's keep going.
Now, I'm the Dr. Montiel, and I'm presenting to you how to prevent this disease. Okay, measles, the prevention of measles is that's the best way that oh, a lot of countries use. So United States is one country that uses this method to prevent this, and the vaccine is given in 2 doses, with first dose administered at age 12 through 15 months, and the second dose administered at age 4 through 6 years. One vaccine of measles provides around 93% protection against measles. A second booster dose, which started to be recommended in 1990, helps to improve the effectiveness of the measles vaccine to more than 97%. So we can see that our patient Diego Barrientos is so defectuous because he has a lot of points and marks. So let's help him with caring us about the
So,
so
Sandy,
about measles.
like the only way to not get these measles, the measles, is to get vaccinated, right? Right? Is the most effective way to not to get this illness, right? Scientist Montiel.
Yes, yes.
Okay.
We are going to describe how these barriers are related to the symptoms that often occur when someone gets sick. So here is one barrier that is contrasted with the flu. So immune cells ingest and destroy the viruses by recognizing tested one attached to viral surfaces. So these barriers help us with the flu counteraction.
Okay, and well, yeah, you can get back to the other. Please, thank you. Well, now I'm going to talk about the types of barriers to eliminate pathogens. Natural barriers are skin, mucous membranes, tears, airways, mucus, and stomach acid. In addition, like the normal flow of urine, it eliminates the microorganisms that increase through the urinary tract. And well, there's also the immune system that use white blood cells, the leukocytes, and assist to identify and eliminate these microorganisms that have crossed natural barriers. So thank you for watching, and we hope you liked it.
We have finished with this program, so thank you. Goodbye.
Thanks for your attention. Thanks to the guests, to the special kid. Thank you for watching, and see you next time.
Thank you so much, special kid.
Virgen morena, siempre vas caminando conmigo y tu voz aconseja mi oído. Virgen, me dijiste que yo soy tu hijo más pequeño y tu manto envolviste en mi cuerpo. No sabía escucharte.